So today the topic's going to be on mindfulness and self-compassion for healthcare professionals. And I'm just wanting to kind of get a sense of who you are. I'm assuming everyone's working in the health profession in some way. How many people are nurses? Okay. Caseworkers, frontline workers. Yeah. Physicians, social. I know. A couple of social. Yeah. Social workers. Any fellow social workers? Yeah. Okay. Anyone else that I've volunteers?
I work in fundraising.
Fundraising. Okay. Okay. Great.
A recreation therapist.
Rec therapist. Okay. Great. So we have a nice diverse crowd. Anyone else I missed out on? Okay. So a lot of diversity in the crowd. What I want to talk about today, so I teach mindfulness groups. So many of you probably have heard of these groups that we offer through hospitals and also in other community agencies, mindfulness-based cognitive therapy or mindfulness-based stress reduction groups. So I do that for patients. But what I think is really, really important for us to acknowledge, and I know there's a lot of attention on how we offer mindfulness programs for patients for their mental health and well-being, but so important for us to actually take some of the practices for ourselves in the kind of work that we do. So what I want to talk about today is the actual practice of mindfulness and self-care for ourselves and how we can use the practices, how we can understand the practices to actually improve the quality of care that we provide for patients. Because really, the quality of care that we provide for people is directly related to the quality of care that we provide for ourselves. And we tend to lose sight of this quite a bit. So what I'm hoping that we can do today is reflect on that and to also do some practices. So I'd like this to be a reflective experience for all of us, but also to learn some practical exercises for cultivating self-compassion for ourselves. So these are the goals of the presentations: to understand what is mindfulness and self-compassion. Just wonder, how many people have some introduction or experience with mindfulness? Okay. Anyone, is it new? Newish. Okay. So I would assume many of you have some understanding what is, if not some practice, which should motivate you to show up today. I want to reflect on the importance of taking care of ourselves while working with the suffering of others, and to become more aware and connected to our compassionate nature. And also to learn new habits of mind, skills to develop, some very practical skills to develop self-compassion. So what I'd like to do is just actually start with a practice itself. So mindfulness is a different way of engaging our minds, engaging our awareness. So what I'd like us to do is to take a moment to turn inward and actually practice mindfulness. So I'm going to use my voice to guide you through the practice. And I just ask you to, you can either literally put things down or just drop your pen, drop whatever you're holding, and direct your attention inward. So you can either close your eyes or you can lower your gaze. So just take a moment to turn inward. So mindfulness begins with stopping. So we shift from our busy doing mode, engaging our thinking mind, and we engage our observing mind. And just notice what's here in the present moment. So noticing what's here in the present moment as you turn inward. So noticing what's happening in your body. Notice how your body feels in this moment. Does your body feel energized? Does it feel tired? Does it feel agitated or sore? Notice what's happening in your mind and your thoughts. So what is the quality of your thoughts right now? Are your thoughts scattered? Are they slow and sluggish? Are they jumping from one thought to the other? And also, can you notice what's happening with your emotions? Are there any emotions that are here? Strong emotions, subtle emotions. So mindfulness gives us an opportunity to stop, let go of our doing mode, and just observe what's right here, right now. Just allowing the thoughts to settle. Entering into a place of stillness for just a few moments. And notice what that's like to be in a place of stillness. Does the mind want to be agitated? Does the mind want to start planning? So I'm going to introduce a question for you as you just rest in this place of stillness. Reflecting on what brings you to your role in healthcare. What actually brought you or inspired you to be working as a healthcare professional? Just dropping that question into your mind. And then also dropping this question of what challenges are there for you to still stay connected to your inspiration? What challenges get in the way? So holding both in mind, what brings you to healthcare, to work with others who are sick, struggling, and what gets in the way of your inspiration. So we'll use the sound of the bell to signal the transition from this inward focus to an outward focus. So coming back into the room, opening your eyes. So let me pose that question to the group. So, what was your inspiration? What motivated you to pursue a career in healthcare? Anything come up for people? Any thoughts? Yes.
The reason I came to health as a health professional is I grew up in a society where everybody has to help each other.
Yes.
In my early age, I have to take care of my grandparents.
Okay.
From my dad's side, my mom's side. So, in addition to that, I have a lot of family members who are in health professionals, and I always appreciate what they are doing for others. So, I plan to go to medical school, but just because of certain circumstances, I went to economics. And then I wait another opportunity where I can go back to my own compassion. So I came to Canada. I said, why not we go back? So I tried nursing, it works, I love it.
And you love it, yeah.
I don't think anything makes me more happy than helping others and help themselves. So
Okay.
I'm happy and I'm really more happy.
So this inspiration to really be there for others in their suffering, and also inspiration for others in your family, your community, that this is what you do. Yeah, lovely. Thank you for sharing that. Any other thoughts? What brought you to healthcare? Yes.
I had a memory of when I was younger and I had a good experience in healthcare setting, practitioner.
So also inspiration from your own personal experience with others. Lovely. Yeah. Anyone else want to just share a little bit? Yes.
I've always liked working with people and helping people in any way. So I used to be a hairstylist and a fitness professional. And then while I was working as a hairstylist, I just felt like I wanted to dig deeper.
Ah, okay. Because you're helping people anyway. Yeah.
You're talking, right? But
Exactly.
It's not the main part of your job. You know, your job is to make people look nice.
Sure.
But I felt like I wanted to get in deeper.
Get in deeper, okay.
People's minds and work closer with
Yeah.
when they have like a condition.
Uh-huh.
And also really rough minds.
Yeah.
So, yes.
So that sparked your interest of really getting to know people and work with their suffering. Yeah, thank you for sharing that. So let me ask you the other question. What gets in the way? What gets in the way? Yes.
For me, it's balancing life, your personal life,
Mhm.
family, commitment, and life.
Okay, so balance. Yeah, just lots of commitments. Yeah.
Yeah.
Mhm. What else? What gets in the way?
It's also challenging when you have difficult
Yes.
patients or difficult clients.
Sure. Yeah. So the patient population can also get in the way of our deeper inspiration. So, so we come to this for particular reasons. Sometimes it's hard to remember or access the memories of what actually inspired us to pursue this career, which is not an easy path. But I think it's really helpful to reflect on that and also reflect on what's actually driving us to keep going. This is a hard path that we've all chosen. And we do hear a lot about stress in healthcare and how there's really like an epidemic of overload and burden and stress in healthcare workers. And there's a lot of factors that are contributing to stress of healthcare workers. One of them being role overload. So we have too many responsibilities and not enough resources to actually provide quality of care that we need to provide. And you know, we were just talking, Adriana, we were just talking about how we can find ourselves in a place where everything's balanced just right. We can kind of keep all the balls juggling, and then one thing happens. You just add, one more responsibility, or something kind of comes out of the blue at you, and the whole system just breaks apart. So role overload is, and we see this a lot with the budgets changing, people's responsibilities being transferred to other people. It's this is a reality. This is this contributes to our experience of stress. There's constantly systems changes, and work in a hospital, and the one thing that's constant is change. And the one thing that we do know is that we have to accept that that's never going to change. But we also have to acknowledge that they cause stress for those of us who are actually working on the front lines, for everybody, that systems changes are stressful. And then this other thing that we're dealing with is what we call continuous partial awareness. So this has even gotten worse with technology, that we're constantly paying attention to many different things all at the same time. And that's really hard to do. It's not natural for us to be constantly juggling many things at the same time. And that also has an impact on the quality of care that we provide if we're not actually fully engaged and fully there. And it's also stressful. It's stressful to have to keep changing your focus from one thing to another. So this, and we have emails that are constantly going off, we have pagers constantly going off, we have being in the hospital we always have these messages, the codes being called. There's constant things that are pulling at our attention. So this, and we talk about when we go into a job interview, and we may actually try to promote ourselves by saying, I can multitask, I can do many things at once, which is great. But what we do lose the ability to do, and the skill, is to really focus and pay attention to one thing for a sustained period of time. And that's actually much less stressful to just focus on one thing at one time. So those are contributors that are external. The internal stressors are also there. And so that's really what I want to talk about today, because we can't change the external stressors. We know that they're going to be there. Hopefully, there's some activists amongst us who may try to work towards the systems changes, but the internal stressors is something that we can do about. So how we actually respond to stress. What we can notice if we start to pay attention more closely is that the own messages that we tell ourselves about how we cope with stress can really make it worse. So we can notice that there tends to be a critical element in our an internal voice. It's that one of self-judgment, which also contributes to the sense of compassion fatigue, like just not being able to really feel that sense of presence, that sense of generosity for others if we're just so overwhelmed ourselves. And bottom line is caregiving is hard. Caregiving is a very hard profession to be engaged in, and we can make it easier through our own inner work. So mindfulness has got a lot of attention. Mindfulness is something that I think we all hear a lot through mental health and healthcare, and also it's become more accessible to the larger population. So many people are practicing mindfulness. Many people are taking up meditation as a way of managing their stress. And so we tend to associate mindfulness with a form of practice called meditation, and associate it with a way of being aware, a way of being present in the present moment. The other part that we don't pay so much attention to is the attitude of presence that we take. So it's not just about being aware of what's happening in the present moment. It's the other wing of this bird. So there's two, like to use the image of the wings of a bird, there's the concentration part, the awareness part, but there's also the compassion aspect of it. So as we pay attention to what's happening in the present moment, what's the quality of our attention? Is it a kind attention? Is it a compassionate attention? So is there an attitude of kindness to our experience as it's happening? Because it's one thing to say, oh yeah, I'm very mindful. I know what's happening right now in the present moment. And part of that is like, I don't really like it. I don't like, I'm very judgmental about myself or what's actually happening. I don't like it. The compassion piece is to actually see it as it is, but hold it with a sense of acceptance and kindness. So the compassion piece is the one I want to talk about today. So mindfulness. Here's a definition from Jon Kabat-Zinn. So many of you may have heard of Jon Kabat-Zinn. He's like a guru in mindfulness and this movement of bringing mindfulness into healthcare settings. He created this program called Mindfulness-Based Stress Reduction, which is an 8-week program offered through hospitals. And so his program was really the one that got it started, where we could actually talk about mindfulness and meditation through these kinds of settings. And written a lot of books. So his definition, which is sort of the standard definition we keep going back to, is it means paying attention in a particular way on purpose in the present moment and non-judgmentally. So when we did the practice today, I invited you, so this is the definition, the meditation invited you to experience it, actually experience it. So how can you pay attention and just notice, engaging that observing mind rather than thinking mind in the present moment. So what is happening in your body, what's happening in your thoughts, what's happening in your emotions, and just pay attention to that, be aware. So the compassion part of this. So let me just throw out the question to you rather than going by the definition. What does compassion mean to you? What words come to mind as you think about compassion? Any words?
Kindness.
Kindness, okay. Mm-hmm. Caring, okay. Empathy, okay. So feeling for the other person as well. Mm-hmm. So kindness, caring, empathy. So compassion is a deep feeling of deep sympathy and sorrow for another who is stricken by suffering or misfortune, accompanied by a strong desire to alleviate the pain or remove its cause. So compassion is really identified with the other person. So oftentimes we may think of compassion as to be truly compassionate, we have to really engage with the feelings of other people. But one of the things that might be a bit misleading is, do we have to actually take on their suffering? So we can be aware of someone's suffering and see it either at an arm's length. That's not really feeling the empathetic aspect of it. So we can see that, okay, there's someone suffering. We can take on their suffering and really, really feel it. But really what we're doing with compassion is being able to meet it. So I think the misunderstandings about compassion is that we have to take it on in order to really, really feel it. And that's not necessarily true. So one of the things that contributes to burnout, caregiver burnout, is this notion that we actually have to take it on. We can identify with it and say, yeah, I'm very close to that person who's suffering. That could be me. But I don't have to actually feel it and take it on. I can sit with it, I can meet it as it is, but I don't have to take it on. And I'll share a little story from one of the people I've been working with through the mindfulness groups, who was a caregiver for a long time, many years, and she's been practicing mindfulness. She's been practicing mindfulness for a long time, but she came to a point in her career where she was burnt out. She was really burnt out. She was taking on the suffering of others in a very visceral way, and it led her to a place of having to leave her work. And so she's taken a lot of time to focus on self-care, which was missing for many years. And she needed to be practicing it while she was working, but she got to a point where after some decades, she had to leave it. And so she shared a story, it was just this week actually, she shared a story where she had been called by some friends about a person who lived in the same building as her, an elderly person who she'd been caring for in a more informal way. And she heard that this person had died very suddenly in the night. And it was very unexpected because she was elderly, but nothing had happened where she was like starting to decline. It was just quite sudden. And she shared that she was really, she felt for this woman, but she's also like okay with it. She was accepting of it. And so this was like a really new experience for her, that she didn't actually take on her suffering. She actually didn't feel bad about it. So she was able to really be present with the loss, but not at a cost to herself. And this is something that she attributed her mindfulness practice to, is that she had got from a place where instinctively she knew she had been taking on other people's suffering to, oh, I can actually be with someone or be with a loss and not have it be at a cost to myself. So self-compassion. Self-compassion is similar to compassion, but it's a real acknowledgement of our own involvement with the suffering of others. So Christopher Germer defines it as a basic kindness with a deep awareness of the suffering of oneself and others. So we include ourselves. And the quality of self-compassion is something that we all have and that we can all develop through intentional practices. And some of us may have a greater sense of self-compassion more naturally, either just the way we are, or maybe the environments that we've grown up in. But what we do know is that self-compassion builds resiliency against a lot of misfortunes in life, and against depression and anxiety, and it increases life satisfaction, optimism, social connectedness, and happiness. So Christopher Germer and Kristen Neff, they're two psychologists who've done a lot of research on just this concept of self-compassion. And they've also broken it down. So there's 3 components of self-compassion. So the first component is kindness. So treating self and others with care and understanding. And it involves active soothing and comforting. So there's the active part of it, but there's also the attitudinal aspect of it. So it's one thing to say, yeah, I'm going to go and get a massage, or I'm going to take myself off on a holiday, but there can be active soothing and comforting through what we do, but it has to be coupled with the attitude of self-kindness and compassion. The other component is common humanity, seeing the experience of self and others as part of a larger experience. So in the groups that I run, so people come and they have been struggling with depression or anxiety, some kind of mental health problem. And the common experience for, I would say, all people, is that they feel isolated. They feel like they're alone. Nobody else understands them. They have to hide the fact that they're depressed or anxious. They're struggling with whatever they're struggling with. And this makes it worse, the actual problem, much worse than it is. And what I notice, what I see in every single group, so one of the nice things about running groups is that people get to see their relationship to others, with other people. And I always see that there's a huge shift in that sense of common humanity. That, this is a comment that usually happens around session 5 or 6, and say, so they will start by saying things like, I'm the only one who can't do this. I'm the only one that's struggling. And then when they hear other people's comments, they start to see, that person is struggling just like me. I understand what that person is saying. And there's a huge sense of relief that comes along with that quality of common humanity. The last component is mindfulness. So mindfulness, which we already talked about, is that sense of equanimity in being able to be present with what is happening in the present moment without aversion, without avoidance. So even though the suffering is there, even though they're still struggling with the mood, with whatever external stressors are going on in their lives, they don't have to work so hard to turn away from it. So these are 3 essential components of self-compassion. Research findings. So there's been a lot of research specifically on self-compassion as opposed to just mindfulness. So some of the research shows that it softens the impact of negative events. So how people respond to negative events is changed. So it's not that the events themselves are going to go away, it's how they respond. Self-compassion is correlated with high self-esteem. So how people feel about themselves is improved, but they don't have aversion to failure. So they're more willing to take risks, to try things on, and they may not fall into the pattern of beating themselves up about failure. So that's another interesting finding. There's a high correlation with wisdom, initiative, happiness, optimism, life satisfaction, social connectedness. So all of these positive qualities of our mental health. And that's something that we haven't really given enough attention to, but the positive psychology movement is really paying attention to. And then there's another researcher and clinician, it's a psychiatrist in England called Paul Gilbert, and he's looking at what actually happens in people's bodies when they practice compassion, and that they actually have a difference in the levels of their good hormones, the happiness hormones like oxytocin. The other thing that's interesting with the research is that we have more knowledge about what actually happens in the brain. So with technology, we can do these scans of the inside of people's brains when they practice self-compassion. And there's another researcher by the name of Richie Davidson who's really pioneered this research specifically around self-compassion. And so what they did was they they did these fMRI scans of people's brains while they were learning this practice, a specific practice on cultivating metta meaning meaning compassion. And so they had another control group where the other group would do a different kind of practice. I think it was more along the lines of what you might do in CBT, some cognitive reappraisal, versus this practice of doing a 30-minute compassion meditation every day for 2 weeks, so just a short period of time. And what they found was that the metta group had more activity in a part of the brain called the insula, which is responsible for our awareness of internal feelings. So they were able to be more present to what's actually happening in their bodies. And the insula is also an indicator of empathy. And so when they looked at distressing photos, they could actually be more aware of what's actually happening in their body versus not really like tuning out or avoiding. So they could actually be present with that. The other thing that was interesting was that they gave them an option after the study where they could, so they were given an honorarium and they were given the opportunity to donate, either to keep the honorarium or to donate it to a charity of their choice. And what they found was that the people who had more activity in the insula were more inclined to give more. So that was kind of interesting. So that's a little bit about the research. What I'd like to do is to guide us through an actual compassion meditation. So it's different from the one that we started with, which was a mindfulness practice of just paying attention in the present moment. And this practice, so it's another guided meditation, but it's a little bit different in that we're actually trying to strengthen a feeling, strengthen a quality, particularly of compassion, okay? So once again, I would just invite you to take a moment to put everything down, and we're going to actually go through a guided meditation. And this will be a little bit longer, this meditation. So really important to experience it, okay? And really give yourself the opportunity to explore this, explore what this is like from an experiential point of view. So really make an effort, set your intention to let go of your thinking mind and go into this exploring or observing mind, okay? So setting yourselves up for the meditation, just find a comfortable position to settle your body and mind. So traditionally, we do like to sit in an upright posture so we can be alert as possible, but comfortable, still comfortable. And then we close our eyes. So if that feels comfortable, close the eyes, or if it doesn't feel comfortable, have your gaze lowered. So resting your eyes softly ahead of you so you're not too distracted. Allow your mind to settle. So really allow yourself to rest in stillness. Feel your feet connected to the ground. Just feel the sensations of your feet on the ground. Directing your awareness to your body. Feel the heaviness of your legs, the backs of your legs on the chair. And then sitting in a position that feels upright yet relaxed. And allow your arms to be heavy, shoulders relaxed. Just take some time to really intentionally slow things down. Take time to rest. Rest your nervous system. Just connect with your breath. feeling your breath as it moves through your body. And start to settle into a deeper, slower pace of breath so you can relax your body and your mind. So in this practice, we try to cultivate a feeling of warmth and compassion through images and through phrases. So to begin, I invite you to choose an image of a loved one. And it can be a pet or it could be a child, just one person or one animal. And as soon as you hold that image in your mind's eye, a feeling of warmth and kindness arises just automatically. And stay with that feeling. And then find some phrases, find some words that express your feeling of kindness towards this being. So some traditional phrases are, may I feel happy, may you feel happy. May you be healthy. May you feel safe and protected. May you be at peace and live with ease. So just notice what it's like to say those phrases. Whatever feelings arise. And now letting go of that image of your loved one, and can you hold your own image in your mind's eye? It's forming an image of your whole self sitting in the chair. And just as you directed those wishes of well-being to the loved one, can you direct those wishes to yourselves? So knowing that just like this loved one, just like all people, that you also wish to be well. May I be happy. May I be healthy in my body and my mind. May I be safe and free from danger. May I be at peace and live with ease. Maybe finding some words that reflect your wishes of well-being as a caregiver, as a health professional. May I be present for others. May I not be overburdened by my responsibilities. May I find joy and satisfaction in the work that I do. May I be happy. May I be healthy. May I take good care of myself as I take care of others, and give myself permission to do so. So just take a minute or so to sit with those phrases, with those intentions, allowing your mind to concentrate on cultivating compassion. Setting your intention. And whatever feelings arise, just allow them to arise. It may be a feeling of kindness, or it may be no feeling, or it may be an opposite feeling. Just taking a minute to just catch your breath. And then we're going to use the sound of the bell to transition out of the meditation. So, just wondering if anyone would like to just offer anything that came up for them to offer to the group. Would you like to offer something? You fell asleep? Yeah, you're tired? Okay, yeah. Sleepiness often arises when we just stop and be still. Yeah. Anyone else like to offer any part of their experience?
I kept asking myself why I'm so hard on myself and push myself into situations that shouldn't.
So there's a realization that
Yeah.
that some of this is maybe not necessary. Yeah. So a lot of questions can arise when we just notice this. Yeah. Anyone find it challenging? Yes.
I was just going to say, maybe the first meditation, you brought up emotion, and
Yes.
I had no real emotion.
Yeah. And what was the big time?
Yeah, this is obviously like a compassionate ones are a more emotional
Mm-hmm.
flow. For me, it was a more emotional experience.
Would you feel comfortable sharing what kind of emotion, whether even specific or just positive, negative?
It was positive, and
Okay.
it was like feelings of gratitude.
Feelings of gratitude.
Yeah.
Okay.
Yeah, but that can be like emotional.
What's that?
That can be emotional.
Oh, that's absolutely, that's an emotion, but a pleasant one, right?
Yeah.
Yeah. Overall, yeah. Okay, the overall tone, a little bit nuanced.
Yeah.
Okay, yeah. Anyone else like to offer? Any?
Use my daughter to express positive emotions too. When it was switched to me, I realized the excitement that I was feeling kind of reduced a little bit. It was almost more something professional I was doing to myself as opposed to enjoying a light kind of happy feeling expressing to her. So it was a bit different emotionally. So,
Bit different emotionally to direct it?
yeah, when I directed it to my daughter,
Yes.
there was some excitement.
Okay.
You know.
And then for yourself,
When
it
I
felt,
directed it to me, it was almost if I was doing something professional to myself.
Aha.
It's light.
okay, it wasn't quite natural as you would be, okay, okay.
I had it similar.
Yeah.
I was easier in the first part when you have to be kind and compassion to someone when
Yeah.
you have to do this. That's when the moment I started to think why I am so hard on myself.
Yeah,
You know?
so it's
I
really,
had a similar experience.
really helpful to sort of see how our attitude is quite different towards ourselves and others. Yeah. So thank you for sharing that. Yeah. So it brings up a lot for people. Oh, we had another comment?
I was just a few minutes and then we have to go. The first feeling I had, which I get when I do something like that, is a feeling of connection.
Connection.
Connection and being in service and being together and it's a total, make me so, very good.
So a very pleasant emotion. Yeah. Yeah. Connection, is there anything in particular that you feel connected to?
Connection between us and each of you with each other,
Uh-huh.
help each other, the feeling of big heart.
Mm-hmm.
It's very good.
Yeah, lovely feeling. So when we go inward and connect to what's happening inside, there's a more expansive feeling. Yeah, that's lovely. Yeah, thank you for sharing that. Yes? You work with children? Yes?
We practice this kind of relaxing that feels in my hands and wake up how they feel.
Yes. And what do they say?
They say they have a find themselves.
Ah,
And
lovely.
make it be impactful that girl, the baby moment.
Oh, that's lovely. So, just repeat that because I think the acoustics aren't great in here. So she's just saying that the children, when they do the practice, they feel much more also connected to the earth, more themselves. Yeah.
It's good because after that, they as a teacher, we feel that difference. They also
Yeah. They're calmed down. Yeah, the kids really respond to this, and they get it. It's just kindness. So a lot for kids, they're just pretty straightforward, right? They just they go for it. They're just like, oh, kindness, sure, whatever. But yeah,
I don't know if we're going to cover this
Yeah.
later. But so when you guide us, I thought it was awesome. But But my question after was, how can we do this in the busy day?
Okay.
I think it's
Okay.
It's easier if we have someone like patient in front of us. We have to have support, but I don't see this how easy it can be for us as a self-care.
Yes. Yeah, so that's the challenge, right? So this is the question. What gets in our way, and how can we help ourselves get out of our way? Because as adults, we have lots of things that get in our way. So we have to make an extra effort to do this. And we also have to buy into why we need to do this, because, we are in healthcare. There's lots of things that are taking us away from it. And we have to buy into the fact that, like I was saying at the beginning, the quality of our care is directly related to the quality of care for ourselves. So if we believe that, we have to make the effort to do that. So some things that do get in the way, and this also happens with the people that we work with in the patients who are struggling with more severe mental health issues, is that this can actually bring up, it was nice to hear that some pleasant emotions came up for people. It can actually bring up very unpleasant emotions. It can bring up a sense of, ooh, I can't do that for myself. There's no way. I actually gave a talk for Social Work Week, and there was a lot of people said that it was really hard to do for themselves, and no problem for other people, but for themselves it was very hard. So some of the challenges, so this kind of speaks to this, right? The challenges and misconceptions, especially in healthcare. I don't have time. I'm busy. I don't have time. I should always put others first. Common to hear for caregivers and health professionals. I don't feel any different. So sometimes it's like, well, I don't feel anything, so why should I bother doing it? So that can also happen. It's like when we're just way too busy, we lose that sense of being able to feel. That's the insula part of the brain, and this is what burnout is and compassion fatigue. I don't feel anything. Like, why would I do this? If you think about it, the more we practice, the more we do it, the more we're actually going to feel. And we're going to stimulate a different part of our brain that's going to be contributing to our wellness, our well-being. Some people have some attitudes around which may not be very overtly examined, but attitudes of it's selfish. Like, why should I take care of myself? Like, I need to be looking at other people. And then in the worst case scenario, there can be a sense of what we call backdraft. So it's like for those people who have no self-compassion, have a really strong sense of self-hatred, which is not uncommon in mental health, that because there's been such an emptiness, there's just been no loving kindness or compassion for self, that it's like opening that door of just bringing like that spark in. It can bring up this like a sense of just overwhelming emotions, just too much. So that can also happen. Yeah.
Another challenge I've noticed with myself in the past is that, like for example, when I used to work like 12-hour shifts as an emergency department,
Yeah.
sometimes I wouldn't even urinate like
Yeah. Yeah. Yeah.
And I started to realize like part of the reason why was I didn't want to ask for help because I didn't want to burden other people.
Yeah.
So that desire not to burden others,
Yes.
I think is another challenge in taking care of yourself.
Absolutely. And it's kind of like, I should always put others first, right? I don't want to burden others because I'm not so important, right? But we are all important. Like, we all need to contribute to our acts of self-care are also, like we're talking about, the sense of connectedness. It does help the whole. So we have to buy into that. So some strategies to develop. So this is just sort of an attitudinal strategy, which is from Brach. She says, and this is just what we did in the beginning, learn to just stop and pay attention to your own thoughts. So what's going on in your mind? And then mindfully sense into your feelings. So taking that moment to stop and see what's there. And sometimes there's like just busy or, there's no feelings. It's hard to even sense anything, just noticing that. And then setting your intention. So this is the active part. There's a noticing part, then there's the active part. To actively offer yourself gestures of self-care. So going for a walk. Taking a moment to just stop or read a poem or do something that is not about caring for others. So that is just a very simple strategy that you can do, but it doesn't have to take a long time. But the important thing is that you set the intention to do so. So actually, I'm not going to. Oh no, I'll share that. So this is the important thing: is setting the intention. We have to keep resetting the intention. Something is going to get in our way all the time. There will always be something getting in our way. So we have to make the effort to keep setting our intention over and over and over again to be kind, be compassionate to ourselves. And so the Dalai Lama has some wonderful quotes to sort of help us to keep cultivating that sense of compassion and kindness every day. Just keep coming back to it. It doesn't come naturally to us. And here's some general tips, just general practical tips. And I'm hoping this will just plant some seeds for you to set an intention for yourself that is practical, that you can do, that's not going to feel like it's burdening you, that's actually going to feel like it's nourishing you and actually creating more space in your day. So first thing is to create more mindful moments through your day. So some practical things. Just when you're like on the where you're on the elevator or the subway, times where you actually have to stop, see if you can just let go of your doing busy mode and just be in the present moment. So those moments when it naturally may happen. Find some time for informal practices. So that's what you would do every day anyway, but if you can do it in a way, so making your lunch or eating your lunch or driving to work, or if you're on the TTC. So informal practices are things that you do that are not going to take more time, but you can actually break being on automatic pilot and do it in a more alert, aware way. So when you're with patients and colleagues, you can practice this. And one of the reasons I like doing psychotherapy is because you have to monotask. You can't be doing your shopping list. You got to be paying attention to the person right in front of you. And it's actually an opportunity to be mindfully aware. So we can actually be engaged in our thinking mind problem solving as we're with somebody, but we can also be just really present with them and just noticing, what is happening for them, noticing how they are, how they look, how they feel, but also noticing what's going on internally for you as you're talking to them. If you can establish a formal meditation, that would be fantastic. It really does help to reinforce the feeling that you want to cultivate in your everyday life. A lot of people say they don't have time for it, but if you can do 3 minutes a day, it will make a difference. It will actually make a difference. And test it out for yourself. So see if you can set 3 minutes a day for 1 week and monitor what happens. So tips for self-compassion. Recognize the importance to find time to take care of yourself. Don't wait for a crisis to do so. So it has to be, again, buying in that this is important and to practice it. And it can be as simple as just wishing yourself wishes of well-being. So, and I know that I don't do that when I'm in crisis. So I had an example from my life where I was on a role overload and things just completely fell apart. And I could see my tendency was like, oh, you shouldn't have done so much. You're always making, you think you can keep everything going, but you can't really. And I could hear that critical, mean voice starting to go. And I was just like, oh, you know what? This just happens. It's okay. This will pass. You will feel better. And may I feel better. May this not continue for too long. So wishing yourself wishes of well-being, even when you feel bad. Resist the brain's negativity bias. So one of the things that I notice is that at the end of the day, I might start to be fixated on the things that I did wrong. And, oh, I should have done that or I shouldn't have done this. But, at the end of the day, we do a lot of great things with people. We actually make a difference in people's lives. So why not spend more time thinking about that? Like, oh, that was a nice interaction with people, or that was a good thing that happened with either patients or colleagues, right? So notice that. Take moments to remind yourself why you went to healthcare. So come back to your original intention. What inspired you? And reset your intention every day. Keep coming back to it, okay? So there's too many things that keep us, veering away from our intention. So keep coming back. Maybe I'll just share this story in closing. So there's a story. Some of you may have heard of it. There's a young boy and an older man on the beach, and it's a beach where there's some parts of the world where the starfish they end up on the shore. They come up with the tide. They end up in the shore. And you can see, if you go on the internet, you can see these places where they're just like littered for, as far as the eye can see. And so this little boy is walking along, and he's picking up the starfish and he's throwing it in the water. He's picking it up, throwing it in the water. And there's tons of these starfish. And the older man says, why are you doing this? You're never going to save all the starfish. And, why does it matter? And as he's continuing to do this, he says, it matters to this starfish. It matters to this starfish. So the point being that in healthcare, we can be looking at that whole beach of, people who need help, that feel, that are suffering, that need our help. And we can feel overwhelmed and burdened and get to that place of burnout where we're thinking, what's the point? Versus, being able just to be present, be mindful. Each moment is an opportunity to just be present, be compassionate with ourselves, compassionate with others, and this matters. This matters. So just reminding ourselves that every moment that we spend with ourselves, with other people, it really matters. So thank you all for having me, and good luck with your ongoing practice. Thank you for coming. So we have, if anyone has any comments or questions, we have a couple of minutes. Yes?
I think this is wonderful, and I'm smiling.
Okay, I'm glad.
Right? So I think it's really meaningful.
Yes.
My question is, you mentioned hospitals provide mindfulness training sessions.
Mostly for patients, yeah.
So how would one take hold of that opportunity, not as even as a patient, but that open up to the community?
That's a good question. So the actual groups. So most of the hospital-based groups are, you need a physician referral.
So it's very kind of a medical model.
It is a medical model. It is. Yes.
How do you engage in self-help or self-compassion?
Yeah. I mean, that's an interesting question because there's so many pathways into this kind of practice. So what we do in the hospital is a specific medical model. So it's, physician referred, and it's in our program it's mental health. But there are a lot more programs that are being offered through communities. So even some family health teams are offering it. Again, it is a medical model, but a lot of places might be more, some of them are through meditation centers. Will offer an intro to meditation or mindfulness, but not everyone's comfortable with that kind of approach. But I think there's, I'm trying to think. I mean, there's a whole community, Mindfulness Toronto, and there's a website there, and lots of different people are offering it through different venues.
I work in Frederick House. So several years back, I worked with Maureen.
With who?
Maureen.
Oh, yes.
House,
Yeah.
where you go to engage a group. And there was, I can't remember the name of the who co-presented with Maureen.
Yes.
And it was wonderful. Like, we do have to sponsor a portion of the cost towards the consultant, but not to this. So we are very blessed to have the opportunity.
Yeah.
So I guess I'm thinking, for the fact that you reach out to take a group.
Yes.
If there are opportunities that at a minimum cost to be offered to groups.
Yeah, I mean, it would be lovely to be able to offer that, and I'm not. Well, I know we're trying to get some funding. I don't know what. I know other hospitals are looking at this, and there's an interest, but I think the challenge is getting the funding to back it up and support. Because I know there's a huge amount of interest. Sick Kids last week had, this was driven by their CEO, it was a mindfulness week, because they wanted to start, they had a whole week focused on mindfulness, and which was, really focused on people in the front lines taking care of themselves. So and they actually have something where it's ongoing practice session every week. So that's a place where they've tried to integrate it.
Is there any tape available that tape, like if you could, I think I said that you could, the tape that you could play for like you mentioned about 3 to 5 minutes.
There's lots. Oh, and actually, I'll speak to the MAST program. So one of the things that we did, so with the grant that was mentioned at the beginning of the talk, so we got a Bell mental health grant to create a program. It's called MAST. So it's 4 weeks. It's shorter than the most of the groups. And with that, so if you go to there's a website with all the materials. So it's mast.stmichaelshospital.com, MAST. And on that, there's, so we created some PDFs. So there's 4 PDFs for each of the sessions. And then there's 7 meditations, and they're anywhere from 3 minutes to 10 minutes long. And there's a compassion meditation in there. So one of the things that we're hoping so we did get some money and we were able to provide some training for people who are frontline workers so they could use it for themselves or for other people. So we did that last December, and we have asked for some more money. We'll see. We'll keep our fingers crossed, because there was a real interest and real need for people to take this into their work and learn more. Absolutely, yeah.
Right, so you want to prevent that.
Yeah.
Thank you.
Yeah.